It is just a huge, huge honor for me today to be podcast interviewing Rob Roda. And he's, this is an endodontist, local here in Arizona. The #1 selling root canal book in the world of all time was Pathways to the Pulp by Stephen Cohen. And we had Stephen Cohen on our earlier issue. Rob actually co-wrote Chapter 8 with Brad Gettleman, who we had on the show too. It is just such a huge honor to have the third endodontist from the #1 selling endodontic book in the history of dental textbooks. No, that's a fact.
Well, thank you.
And also, if you look at the numbers, the only book that is in the same space with us in volume of sales worldwide was Carl Misch's book on implantology.
Yeah.
So you guys are up here, and if you cut the sales of this in 5 ways, the 1/5 wouldn't even be a close second. So congratulations on that. And I know that's a lot of work. Yeah. And you've done everything. I mean, right now you're the president of the Arizona Dental Association.
Yep.
You've taught at the local dental school, AT Still. You've lectured. I mean, I've seen your names on lectures all over. And my gosh, you must get. How do you get 28 hours out of a day?
Well, you know, it's really kind of an interesting thing. I cheat a lot.
You cheat with the coffee monster?
Yeah, that's right. No, actually, I've always had a wonderful support system around me. From my staff in the office, my partners who help me out, and I bounce off everything off them, and great friends, great colleagues, and also I just I don't have a life, so I just really enjoy what I do.
No, you just love what you do. Let me read your bio. Dr. Rhoda graduated from the Faculty of Dentistry at, how do you pronounce that?
Dalhousie.
Dalhousie University in Halifax, Canada. Is that French? Is that in Montreal?
It's in the English part of Canada, which is way out east. Nova Scotia is the farthest east you get until Newfoundland, and then you got Europe.
And he maintained a full-time private general practice in Dartmouth, Nova Scotia for 10 years. He returned to school at Baylor College of Dentistry in Dallas, Texas, and received his Master's of Science, Oral Biology, and Certificate in Endodontics in 1993. He became a Diplomate of the American Board of Endodontics in 98. Dr. Roda has published and lectured internationally, most recently co-authoring the chapter on non-surgical retreatment in the 11th edition of Pathways to the Pulp. He is a visiting lecturer at the Arizona School of Dentistry and Oral Health, past president of the American Association of Endodontists, current president of the Arizona Dental Association, and is active member of the American Dental Association. Dr. Roda is an associate editor of the Journal of Endodontics and is an endodontic consultant to the Arizona State Board of Dental Examiners. He maintains a private practice to endodontics in Scottsdale, Arizona. I mean, my God, you have an impeccable resume. Seriously, thank you so much for driving from the rich part of Scottsdale to down where the poor people live in Phoenix to talk to us guys born in a barn. I want to start, there's so many things I want to talk about, but I want to start with older guys like us read books, and the younger kids are on YouTube and podcasts. So it's very, very skewed. Whenever I get emails, 25% of them, they're still in dental school. 5% are still in undergrad. All the rest are under 30. And thank you so much. About once a week, someone emails me, howard@dentaltown.com, and says, dude, I'm as old as you. And for every time I get that email from you, but do tell us where you're from. I love the stories. We had one this morning from Tokyo, Japan, a dentist from Tokyo, Japan. That was so romantic. But anyway, they're coming out of school. Just 5-10 years ago, they were coming out of AT Still in Midwestern, maybe $250 in debt. Now they're coming out $400 in debt. I mean, the tuition, because those private schools realize that every time they raise the tuition $10,000 a year, they still fill out the class.
Yeah.
So now they're up to like $100,000 a year, and they're dumping 217 dental graduates a year. And they got to pay off these student loans, and they feel like I need to do endo, but half the class comes out there and says, honestly, Howard, I hate endo. I don't ever want to do endo. And then they want to pay off their student loans with a bunch of white bleaching, bonding, fluffy stuff. Can you come out of school $400,000 in debt and pay it off with bleaching, bonding, veneers, and Invisalign and never have to learn endo?
I think the quick answer to that is no. I think that the biggest problem with the student debt bomb, and it's a bomb, it's going to blow up at some point or another. There's going to be a large collapse, and because it's just unsustainable.
It just passed $1.5 trillion.
Well, did you hear about the guy, New York Times, or not New York Times,
Wall Street Journal.
Wall Street Journal just wrote that article about the orthodontist in California, I guess, that has $1 million in student loan debt.
Mormon dude, he was a Mormon dentist in Utah.
Or in Utah.
$1 million in debt.
Yeah. And what was interesting was they said in the article that he was one of over 110 people who had over $1 million in student debt. And I don't know how you finance that, because, I mean, you know, you are a really successful dentist, and I think I'm a pretty successful endodontist. I have no idea how you finance that. But getting back to your question, I think that you cannot do the sort of standard little bread and butter dental procedures for two reasons. One is that you know, just financially it's not as good as doing more complex things. But the other thing is that now we've got the rise of the others, which is the competition that's happening from non-dentists doing what traditionally have been dental things. So, for example,
I love that, the rise of the others.
Yeah, and actually I plagiarized that. There was a book, I believe it was written, well, I'm not going to say who wrote it because I don't recall, but it was a book about 15, 20 years ago talking about how the United States was having the challenge because of the rise of all the other countries, and obviously we're living in that world right now. But the same thing is happening in dentistry. So we've got in the state of North Carolina, the dental board published a cease and desist letter for a corporate group that was having no dentist at all. They were bleaching people's teeth, and there was not a single dentist involved in the entire process. It was just a commercial enterprise, and the board said, no, that's dentistry, you can't do that. And that company sued them, and the whole thing went to the Supreme Court of the United States, who found in favor of the company and said the dental board is a bunch of, in essence what they said was that the dental board were a bunch of dentists who were trying to control their own marketplace. And that has unleashed a floodgate of things. Now we've got all this DIY stuff that you see everywhere, which is amazing. But the biggest challenge, the current one we've got right now in Arizona, is dealing with the advent of the dental therapist. So watch out.
Let's stay with that, those court cases, because DIY for our international guests is do it yourself. There was another place, I forgot where it was. Was it North Carolina or South Carolina? Well, Smiles Direct Club. I mean, what is it? Who owns Invisalign? Align Technology owns Invisalign and Align Tech, and now they bought 17% of Smiles Direct Club, and they are opening malls where beauticians are orally scanning, sending the X-ray to Costa Rica, and they're doing Invisalign without an orthodontist.
Yeah.
So my question is, do you think an orthodontist ever has to look, or a dentist? Do you think the lady doing mani-pedis can do your Invisalign?
No, absolutely not. I think that one of the big faults with our capitalist system is this concept that somehow capitalism works in every single circumstance, and we see it doesn't work in our prison system. It doesn't work in a whole lot of other areas of the economy. But healthcare is difficult, because the way capitalism works is when the person who is the consumer has the ability to say, no, I don't want to do that. And there are certain parts of dentistry maybe where you can get away with that, and cosmetics is one of them. But most of the time, healthcare consumers, which is the patients of the world, don't have the option to say, I don't want to do that. You know, I don't want to buy a TV, so TV manufacturers up their game. But when someone says, my teeth are really crooked and I need to fix it, and I really will have the money to pay an orthodontist, I'm going to go and do this, they don't have a way to say no. And so this group in particular, Smile Direct, again, I'm not, because I'm an endodontist and not an orthodontist, I'm not intimately familiar with the details, but I see that there's this idea that expertise doesn't matter anymore, and that seems to be a trend in our society. And you can go on YouTube and look at the end of the, what do they call it, the priest class? Because that's what we are. We're the priests. Well, now we don't need the priest class anymore. I would challenge that assumption and say, yes, we do. And I think that anybody who thinks they're going to be able to go in and have someone who isn't familiar with dentistry scan their teeth, send it to somewhere else to get Invisalign trays made, send them back to the patient, and there's no dentist there looking to say, well, did that scanner pick up that oral cancer on their palate? Did they see that? Or you know, are we certain that this malocclusion that they've got is something that's treatable with removable trays? Maybe you need fixed braces. So I personally think that expertise is greatly maligned nowadays, and this is just another example of it.
Well, of all the orthodontists that we've polled and surveyed on OrthoTown, they can only treat 20% of their ortho cases with Invisalign.
Okay.
So 80% they're not even using Invisalign, but I think it was a bizarre from the courts because when they start, you've worked with the Arizona State Board of Dental Examiners. That's confusing the international people. The Arizona State Board of Dental Examiner, that's the government agency of dentistry. The Arizona Dental Association, that's the nonprofit volunteer mechanism. But when they set up the state boards, the dentist was the original courts that I learned in reading the Paul Starr's Pulitzer Prize-winning book, The Rise of the American Healthcare System. Mm-hmm. He said that the reason the government stepped in with healthcare is because the asymmetry of the information was so skewed. Like, I know what bottled water is, I know what coffee is, I know what a book is, I know what a phone is, but I don't know if that lotion or potion is going to cure my disease. And so when they said the boards, when we get called before the board, you are guilty till proven innocent. Unlike all the other B2C consumer courts, you're innocent till proven guilty. So when they call you up to the board, your x-rays, exam, and diagnosis and treatment are guilty until you prove they're not. And then now the courts are saying that, you don't need to be a doctor. Because what I'm trying to get to is it's not a transparent transaction. Right. Like when I go buy my readers, I put them on and stand in front of the mirror. But when I go and do it yourself Invisalign at Smiles Direct, I don't know if I have a long face, open bite. I don't know if I have a mixed intake. I don't know any of this stuff.
Yeah, and therein is the other shoe to drop in this thing is that people don't know what's going on. But we all have short memories, and there's actually a large cohort of people in the political world, not the judicial legal world, but in the political world, who really have this belief system that we should not have regulation of any kind. And these are the pure capitalists, so to speak. For example, I believe it was Senator Ted Cruz a few months ago introduced a bill into the Senate to try to reduce the amount of regulation of the sort of boards at the state level, to, I guess, urging states to do that. I haven't read the legislation itself, but I know that
urging
our governor,
state boards to what?
Well, all the boards. There's boards of. It's not just in healthcare; it's everything. There's boards of contractors. There's boards of cosmetology and all these different types. And there's a school of thought that says that these boards are there to help the state protect the consumer and the public. But there's an opposite school of thought that says these are run by the very people who are being governed. And that it's actually protecting the turf of those. And so they say that, for example, a licensure examination is something that isn't to test the knowledge of the person. It's this group, this board, under the auspices of the state government that is actually preventing new people from coming in and becoming competition for them by forcing them to take this exam. I think that's ludicrous, personally. I think that if you haven't shown that you know what's going on, then you haven't shown that you know what's going on. And so a certain amount of expertise and knowledge needs to be demonstrated. And I think a lot of people think that by forcing them to do that, we're somehow protecting our turf and keeping the competition out, which absolutely in this state, as you said, is completely untrue. We've got in Arizona, especially because we have non-dentist owners of dental practices, we have one of the most competitive environments in dentistry that exists in the United States. And does it help the consumer? Yeah, maybe in some cases it can, but I think that overall what it does is it makes it so that people have a great incentive to try to work smarter. But the reality is that there's only so much you can do to cut your cost, and then you start cutting corners, and that's what I don't like when I see that.
Ryan, I just want to stand up for Ludacris. I don't know why he had to bring in my favorite rapper and say that Ted Cruz was Ludacris. Ludacris, you rock, buddy.
I like the rapper Ludacris.
I'm sorry Rob Roda just threw you in the same bus with Ted Cruz. I want to go back to Ted Cruz because he's from Texas, isn't he?
I believe so, yes.
Texas had that Supreme Court ruling where someone was a diplomat of the American Association of Oral Implantology, and was advertising that he was a specialist. The Texas Dental Society, which you're the president of the Arizona Dental Society, sued him and said, you can't call yourself a specialist.
Actually, that was the dental board. That was the state organization. It wasn't the Texas Dental Association. It was the State Board of Dental Examiners of Texas. And they basically went after him under their advertising guidelines, saying, hey, you're violating the guidelines because you're not a specialist, because you're not a member of one of the 9 recognized specialties of the ADA. This went all the way to the Superior Court in Texas, who found that the board's reliance on the ADA as the sole arbiter of who's a specialist and who isn't is a process that is wrong, because the ADA's process could be biased. And it was actually, this lawsuit happened a couple of years after the ADA refused to certify dental anesthesiology as a specialty. And dental anesthesiology is they're a bona fide specialty. They've got training programs, residency programs. They've got journals. They've got their own knowledge. They've got a board. They have all these things that matter in becoming a specialty. And at the last, in 2012 was their last application, the Commission on Dental Education and Licensure of the ADA, who are the group that supervises this, the apparatus, so to speak. The apparatus said, yes, they did it. They've accomplished it after a couple of failed attempts. Now they are good enough to be a specialty. But the final vote went to the House of Delegates, and the House of Delegates, because of political lobbying, ended up voting it down, and that was it. The anesthesiologists weren't having it. So they joined with the American Academy of Implant Dentistry that's been trying to sue their way into specialty status for a long time. And also, I believe, the American Academy of Orofacial Pain. And the fourth group is the oral medicine group. Their name escapes me right now. And they formed a group called the American Board of Dental Specialties, ABDS. And the ABDS has now set themselves up as a competing board for discussion, or for deciding who's a specialist or not. And so the Texas State Court said, you are not allowed to just rely on the ADA. And so
I'm taking notes. I'm not texting my mom.
No, I understand. So thanks. So all the states are revamping their advertising guidelines now in light of this lawsuit to try to maintain high standards of specialty, but at the same time not get caught in a vulnerable position for lawsuits, because nobody wants to get sued.
Well, wow. I'm sorry. I always thought, my walnut brain thought that was started by the Texas.
No, it was the state government.
Ryan, can you? I'm sorry.
Texas.
Specialist. I can't type that. It's the ABDS. Yeah, you just threw so many hot buttons out there. I want to start going through.
Oh, my whole mind is hot buttons.
Well, I'm going to keep you here all afternoon, because when you bring up dental anesthesiology, okay, I've been practicing here 30 years, since '87. My dental office, when you drove in at 40th and Allen, right next to Safeway's, Chase Bank, the old.
So you can walk to work.
It's exactly 3.0 miles.
Yeah.
It's just awesome. Except for my cars get really old, because my car is a 2004, and it still only has 140,000 miles on it.
Yeah.
And it's nothing does ever happen to it, so it'll probably
and so
last
for all of our viewers up in the
200
Northeast, 100,000 miles is something that means low mileage here in a country like Arizona where there's no rust.
Yeah, my God, I have no reason to buy a new car. But gosh darn, every time someone dies in the dental office that I've been here, it's always sedation related. We've had 2 in Yuma, 3 years apart. Yeah. There was one. So a lot of kids listen to you. A lot of them think, well, I'm going to go learn IV sedation at the Holiday Inn and start offering that. But I always think, people don't die from a filling. They don't die from a loose-fitting denture. They die from a sedation. I told them I wouldn't touch that with a 10-foot pole, because what confuses me is, in Arizona, in any of these hospitals, amazing hospitals, you're not allowed to do the sedation and the surgery. Yeah. The only place you see that is in oral surgeons, general dentist, and that deal about the dental anesthesiology. I thought that I just think I'm never gonna. You couldn't beat me with a crowbar and make me start putting people to sleep, because if something goes wrong. And then I also noticed there's only 3 publicly traded dental offices in the world. Oh. 2 of them are in Australia, one 300 Smiles and Pacific Smiles, and one in Singapore, Q&M. And when their Wall Street lawyers looked at all that, they said, well, you can't do any sedation on anyone under 16 or over 65, because that's where all the deaths are.
Yep.
And all the deaths in Arizona, they're all 2- and 3-year-old and 4-year-old kids. And that's why some of the Arizona pediatric dentists, like Jeanette McLean,
yes,
is really big in SDF, because it scares her putting a 2-year-old under.
Yeah.
What do you think about these anesthesia deaths?
You know, it's tragic, and I can tell you that my choice in my practice is that I'm going to always, if anyone needs to be sedated or put to sleep, I'm always going to have an anesthesiologist there, because I believe, and that was my training when I was in dental school, was you can't be an anesthesiologist and a surgeon at the same time. The other thing, just as a quick correction, yes, when deaths happen in dentistry, a lot of times they have to do with anesthesia. But the other thing is that a lot of times it has to do with young children that are small, and the dentist is trying to do a whole bunch of quadrants at once, so they don't have to keep bringing the kid back. And unfortunately, if they're not careful with their calculating, they can overdose the child, and that has happened a couple of times here in the state too. But the sedation really is, I mean, you're taking someone and you're putting them a little closer to death than they are when they're walking around the street. And I've always been, I don't want to just say respectful, I've been terrified of that. The first time I did my first ever rotation as a senior in dental school through our children's hospital, we had a child that was put down under general anesthesia to do ear-to-ear crowns and all that stuff, all on once. And after the procedure was over, everything went really well. And this is with an anesthesiologist, and I noted that there was an anesthesia resident there too, plus the surgeons and everyone else. And surgeons back off, anesthesiologist pulls out the tube, does all this stuff, and then there's like, okay, wake up, they're trying to wake this kid up, and this kid wasn't waking up, and I'm standing there, and I'm a dumb dental student, so I don't get to do anything. I just sit back in the back there, and I'm looking at this thing and thinking, I'm gonna see a kid die. This kid turned blue. He turned the cover of this book. And I was terrified. I've never been so terrified in my life at any moment. And then all of a sudden, and they were rubbing his chest and doing all this stuff trying to get him to wake up. And all of a sudden, big gasp. And within moments, his color went from blue back to pink, and then he was fine. And they're like, oh yeah, that was all fine. But I could tell, looking at those anesthesiologists and the surgeon, they were all terrified themselves. And so I think that the idea of sedating children, unless it's absolutely necessary, is something that needs to be carefully done, and you always have to look at the idea of maybe I should get an anesthesiologist in there, because their training, their expertise is above and beyond, and yeah, it's a specialty.
Yeah, and I wouldn't do it, and a lot of, I just wouldn't do it. I mean, and I can't think of anything that would be a more, I mean, I know dentists that lost a patient, and they were depressed the rest of their life till they died.
Yeah. I don't think you get over it.
And some of it, we had another one in our backyard where the hygienist could numb. Yeah. So she went up, and again, they're trying to do it all in one appointment. So the hygienist went and totally numbed up the kid, but that didn't get communicated to the dentist. Then he came in, he numbed up the kid, and the kid was like 3, and they died.
Oh, man.
And so, I mean, it's just, my gosh.
See, these are tragic. These are tragic. And when this happens in the bleaching kiosk, it's not a big deal. But when it happens in the dental office,
I'm going to alter my questions with hot topics that you're dropping. You said Arizona is one of the few states where a non-dentist can own a dental office.
Yeah.
So, like, we have 50 states. How uncommon is that?
I'm not the right person to ask this to, but I recall my executive director saying that there was like 5.
And what are the
Maybe
pros
10?
or what are the pros and cons? What are the trade-offs? Are you a proponent of a non-dentist owning a dental office,
well,
or
I think that there are pros and cons to it. Obviously, if non-dentists are not allowed to own a dental office, or I shouldn't say that. The way it generally works is they say that a dentist has to be an owner of the dental office, but it doesn't usually say the proportion. So, just because there's only a few states that have non-dentist able to own the practice outright, it doesn't mean that you don't have corporate dentistry in all 50 states, because we do. But what happens is they have to have a dentist who's a part owner of some kind. It does impose a certain amount of control on the part of the dentist, but I think that the reality is that as long as it's properly controlled by state boards of dental examiners. I don't see there's any problem with it. Our board, for example, here in Arizona, we have a law that was passed shortly after they legalized the non-dentist ownership that said that all non-dentist entities that own a dental practice have to get a license to practice from the dental board. And so, and that was the work of the Dental Association pushing that through, so that now they're held to the same standard as a dentist. So I'm not sure that I see a huge difference, except that now people that are not dentists, dental hygienists, for example, there's practices in this state that are owned by dental hygienists, and they hire dentists to work.
One owns like 10.
Yeah, but then there was that one a couple of weeks ago where the dentist quit and the 2 hygienists started doing the work, and then they got arrested for it. It's a Class 6 felony doing dentistry without a license in this state.
In Phoenix, or was that?
That was on the news. That was in USA Today. Yeah.
Last week?
No, I'm going to say probably a month ago now. But there were 2 hygienists that got...
Oh, Ryan, try to find that story. And we have another huge issue because Arizona, like California, Arizona, New Mexico, and Texas, has like a 2,000-mile border with Mexico. They're always... I mean, okay, let's be honest. I've been here 30 years. I could go to any time I've had a yard crew, a maid crew, for 30 years. And anytime I ever went to my gardener, I said, do you know of any dentists from Mexico that are are not American trained practicing? And they're like, yeah, I mean, they could always give you 5 names. And the first time I found out about this is one time I was talking to my yard guy, and he said, are you all right or something? I didn't feel good or had allergies or something. And he goes, because I get a bunch of prescriptions in my car. And I go, why is that? And he goes, well, I always go to the pharmacy in Guadalupe, and it's so cheap. I always buy a bunch of stuff in case I ever get sick. I have all this stuff. But anyway, you and I both know that in California, Arizona, Texas, there's a lot of dental offices ran by non-English speaking dentists, and they're and on. So, have you seen that issue in Arizona?
Well, I'm not sure that I have a problem with a non-English speaking dentist working here, as long as they're licensed and.
But they're not. They're not.
But if they're not licensed, then that is a problem. And yeah, there was an incident actually in Mesa a couple of years ago where there was an unlicensed dentist. This does happen not just in the Hispanic population, but it also happens in any immigrant population, because immigrants tend to feel, especially when they don't speak English very well, they're not that familiar with the culture because they're new arrivals. They feel much more comfortable with people from their own culture doing the dentistry, and unfortunately it does exist that some of these people that are doing that are not licensed, and like any person who's not a licensed dentist, there's no way that we have any kind of control over that, and so they can basically do anything, and nobody really knows what they're doing. And like you say, maybe having a trunk full of pills that you give out, that may not be the safest thing in the world, especially nowadays with this opioid epidemic and everybody concerned about taking painkillers. So. Obviously, as a dental association, we're really concerned about that when people are not practicing dentistry with a license.
You keep dropping these bombs, and I'm trying to ask you my questions, and I can't even get to them. When you talk about opioid epidemic, so when I got out of school 30 years ago, the media, we were the bad guy, physicians and dentists, because grandma's got cancer, she's in pain, you won't give her morphine, you're being skimpish, and all these people are suffering. So the very conservative physicians and dentists from the 80s and the 70s, 60s, they broke open their prescription pad and said, okay, we're going to start doing opiates. So now the pendulum swings, and now we're the bad guy because we gave out all this Vicodin and hydrocodone. You're an endodontist. That's the most painful part of dentistry. It's not from fillings and cleanings and exams. It's molar endo. If you did, you wrote chapter 8 of this book. If you did 100 molar root canals, what % of those would get an opioid?
Well, I can actually tell you that, the exact number, because now in the last 2 years, the Board of Pharmacy has this prescription monitoring program that we have to all sign up for. And in 2017, I prescribed opioids twice out of all the...
In 2017?
Yeah,
and
just 2 prescriptions.
And you did 3 root canals that year?
Yeah. Yeah, that's right. Yeah, I'm
so
2 out of 3. I'm doing well.
2 out of 3?
So, yeah, no, I just prescribed twice. That was all. Because what's happened is that among other things, and not only concern for opioid prescribing, which obviously every practitioner has, But in terms of purely with endodontics, there have been several studies recently out of a couple of universities that showed that if you stagger 600 milligrams of ibuprofen with about 700 or 800 milligrams of Tylenol, give the ibuprofen, 2 hours later give the Tylenol, 2 hours later give ibuprofen, 2 hours later give you Tylenol, that absolutely is as good as a Vicodin 5.
It actually that study, every time they do that study, it's better.
Yeah,
it's better. It's better every single time.
Yeah,
but come on, this is Dentistry Uncensored. What percent of our homies out there, every single molar root canal, they give them Pen BK 500 milligrams and 20 tabs of Vicodin?
Yeah.
I mean, seriously, what percent does your gut feeling say for the United States of America?
I would say, I don't have any statistics to go on that are official, but my gut would tell me probably about half.
Yeah. So then we're also getting in all kinds of trouble about superbugs. They got this kid.
Yeah.
And also I've been seeing a lot of bizarre research showing that America is 5% of the planet, but we take half the prescriptions, and that they'll take identical twins. And one girl, when she was 3, had a prescription for an ear infection, and the twin sister didn't. Now the one that had 1 round of antibiotics is putting on more weight and obesity. So they're saying the antibiotics are throwing off all of her gut flora, the bugs are getting immune to it. What would you say to a dentist that every single root canal just writes up Pen BK and 20 tabs of Vicodin?
I would say stop now. Don't do it. People get penicillin or amoxicillin, or if they're allergic to that, clindamycin, and those are the 3. I see a lot of Keflex out there. Keflex, no bueno. Those are the big 3, and you do that if someone has a necrotic pulp, if they have swelling, fever, lymphadenopathy. You don't do it if they have a cold sensitive tooth, because cold sensitivity is not helped with antibiotics. You don't do it with irreversible pulpitis. That's not helped with antibiotics. And so if you're using it judiciously, and of course the best thing, even better than antibiotics, is actually get in there and do something. Open up the tooth to clean it out. Or if you're going to extract it, extract the tooth. Just local measures, incision and drainage, all these things. I hardly ever write prescriptions for antibiotics. And to be honest, I did. I used to. Back in the 80s, when I was a general dentist especially, but even as I got out of graduate program, I would prescribe more. But I'm finding that I'm doing less and less and less and less. Now, it's not as little as the opioids, but absolutely positively, the overprescription of antibiotics is causing the rise of the superbugs, Clostridium difficile associated disease, which is CDAD, or antibiotic-related colitis. We used to call it pseudomembranous colitis. We didn't know what it was. It's caused because you've got a bacteria that can live through the antibiotics that wipe out the rest of the gut flora, and this Clostridium bug grows, creates 2 toxins that destroy the colon, and it's a horrible, horrible way to go. And the new version of it, the NAP1 strain that came out in 2003, now has a mortality rate. 20% of the people over the age of 65 that get Clostridium disease are going to die. And again, you talk about what happens when you're a dentist and one of your patients dies. They can die from that, but from anesthesia overdose. But they can also die from a lot of things, including Clostridium disease. So don't overprescribe antibiotics, and I mean you.
Okay, name the 3 that you said. You said Pen BK and
clindamycin for people who are allergic, and then the Pen BK I put / amoxicillin. I think that they're both.
Okay, but you specifically said no bueno on Keflex. Why did you say that?
The problem with Keflex is that it doesn't have a spectrum that covers all the bugs that are used for dental infections. And you'll find, like, even in books like this, the only time you use Keflex is when for some reason you can't use that one, or that one. And even then, I would probably go with something more like a Z-Pak or something like that, as opposed to Keflex. Keflex it's not that effective. And when I see patients that come in and their dentist, and they did have an infection, and the dentist put them on amoxicillin, penicillin, and clindamycin, they come in to see me, and they've gotten some relief from that. With Keflex, it's a real crapshoot. Sometimes they do, sometimes they don't.
By the way, I'm not letting you out of here until you autograph my book. I want to have and not on a piece of paper you can tear out. You got to write it on the hard part.
All right.
Well, the one thing I want to tell the kids is the one thing I think is bizarre in their endo training is that it seems like every time they want to learn something about endo, they always got to go to Sky Harbor, fly across the country, drop several thousand on a course, and I'm like, you need to be cheap. And
yeah,
this book, I don't know what the hell is there anything not covered in this endo book?
Not much. That's
Yeah, and how much does this book cost?
pretty comprehensive. It's probably somewhere between 150 and 200 probably.
Yeah, and what would their plane ticket to the course cost?
Right, exactly.
300.
3 or 4.
And then the course. I mean, there's endo courses in Santa Barbara that are $3,000 a weekend.
Yeah.
And I remember when I went and saw Mish the first time, all these people were asking all these questions. I'm like, dude, all your questions were in the first 3 chapters of his book.
Yeah.
And they're like, oh, I didn't read his book. It's like, I mean, just like college, you read the book. So then when you hear the lecture, then you can see if you got straightened out, then ask the question. What does everybody else do? They didn't read the book. They're listening to these lectures, and they're asking all these stupid questions like, what did he say? What did he say? And then when they would try to read the book? The night before the test.
Yeah.
And those were what we called the 4950s. Me and Dubkin and Paul Gosar, because back at Creighton, 5,000 people would apply to that Creighton Dent School, and they'd accept 50.
Okay.
So the 4950 were the ones that wouldn't get in. And we'd always say, yeah, that guy's a 4950. He doesn't have a chance. But when you looked at the Paul Gosars, Joe Dovkins, things like that, I mean, you start with the damn book.
Yeah.
You say you want to learn how to place implants. Well, start by reading the other best-selling dental book in the history of dental textbooks, Mish's Pathways to the Pulp. Can you get me his that last book? The implant book, it's laying on the side there.
I read that book. That's an excellent book.
Yeah.
You know.
Which leads me to my next question, because again, there's probably like one guy as old as us watching right now. And I'm going to have, in fact, my oldest, so I have 4 boys, my oldest one's dropping his 4th boy.
Oh, wow.
Any minute now. I mean, any minute. We almost, I said, we're not going to cancel Rob. I said, we're not. I said, this is so rare.
Wow.
We'll just get there late. Plus, it's the 4th one. I mean, you get all excited on the first 3, but the 4th one, we'll just show up with a Whataburger. But Misha's Avoiding Complications of Oral Implantology. I mean, my gosh, that's a Bible. Look at these 2 books. I mean, you could take them to the gym just to work out with. And so that's how you get all the information for lowest price. But again, 25% of our audience is still in school. One of the things that really confuses them, they don't know irreversible pulpitis, first time root canal, that's one thing. But they don't know if they should retreat with this or pull the tooth out and go with implants. How would you guide a 25-year-old dentist in Glendale to retreat, send her to Brad and retreat the root canal, or send her to you and retreat the root canal, or send her to the oral surgeon and extract it and fix it with titanium?
I guess in terms of the actual, there's a couple of ways to look at that. Number one, what are the outcomes of treatment? Outcomes of non-surgical or surgical retreatment are extremely high. And in fact, one of the things that's interesting
Say that again?
The outcomes of non-surgical retreatment or surgical retreatment, which is commonly called an apicoectomy, are extremely high. And what's interesting is it used to be with the older techniques of surgery that the non-surgical retreatment was a much higher success rate. But in the last 20 years, that has flip-flopped. And now surgery actually has a higher success rate in 4 different meta-analyses that have come out over the last 8 years than non-surgical retreatment. And so the options have never been better for trying to save a tooth. Now, I'm not saying that there's anything wrong with a dental implant, and dental implants are awesome, so are bridges, so is a removable partial denture. And when you have to lose a tooth, then that's a great idea. But if there's any way to save a tooth, it's usually better to try to do that, even if you're only going to get a few more years out of it. Because as we're learning more and more about the long-term implications of dental implants, with pericoronitis becoming rampant after 15 or 20 years with these things, you start to say, I think a new philosophy is growing. I mean, you remember the days when they used to say that a natural tooth was simply a space maintainer for the future implant?
Right.
Well, now they're not saying that anymore. All the people, and it's funny because I learned that quite a few years ago from the real savvy oral surgeons and periodontists in Scottsdale who were real smart, and they started seeing this, ooh, wait, now I'm seeing a lot of my stuff coming back, and there's problems here. And once that tooth's gone, and you got an implant, and the implant has a problem, now you've really got some challenges. And so they started redirecting to me to say, is there any way to fix this? Is there any way to save this? And so the new philosophy I think that's coming out with implants is the same as the philosophy that doctors have had with knee joints and hip joints for a long time, which is wait as long as you can. Don't do it right away. Try to save teeth as long as you can. The problem is that the general public has this idea that somehow we're making toasters or we're building television sets. We're not. We're doing healthcare. We're applying the best knowledge and technology we have to an imperfectly understood system, and sometimes even the best treatments don't work. And people want a guarantee, they want a warranty, they want to think that, and that is not how healthcare works. Now, they don't ask for a warranty from the guy who put the hip in there, put the new hip joint in, but sure as heck for us, they get really angry when something goes wrong. Partly that's our fault, partly it's because of the society just sort of kind of demeaning what dentists do compared to what their physicians do, and so you get into this this kind of a dichotomy. But one of the things the public has to realize is that the human mouth is in a state of degeneration from the time the teeth erupt to the time that they die, and that degeneration never stops. It's relentless and it's ongoing, and the only thing we can do as dentists is to slow it down so that by the time that person dies, they've got a relatively full complement of healthy natural teeth. That is a successful course of dentistry over the lifetime of a human. And so while we would love to think that everything we do lasts forever, we all know that it doesn't, and things are going to break down. The oral environment is so hostile. I tell people, they get mad at me. They say, well, my dentist put this bridge in and now it's got decay. And I say, well, when did they put the bridge in? Oh, 30 years ago. And I'm really angry that this thing failed. And I'm like, what are you talking about? You got to be kidding me. If you took your Mercedes that you just paid $70,000 or $80,000 for and you put that in an environment where it's bathed in corrosive solutions and the temperature goes from the temperature of hot coffee to the temperature of ice cream back and forth at dessert for dinner, plus you're pounding it with sledgehammers to 1,200 pounds of pressure per square inch, or 600 pounds of pressure per square inch, 1,200 times a day, that car's not going to last a day. I am proud of dentistry. I am so proud of what we do because what we do lasts in this incredibly hostile environment. And so what we want to do, though, is realizing that everything is degrading, is go from step A to step B to C to D, and if E is implants, go to E. Don't go from B right to E. Go right through the thing. Now, what the young dentist, going back to your question, in Glendale is going to say is, well, I've got a root canal, it has post-treatment disease. How do I decide if it's fixable or not? Well, you read the book, lots of stuff in here that will help you with that.
And thanks for writing that. It was an awesome read.
The whole book is an awesome read. And there's a lot of other authors in there, and it's all, every shred of it is good material. But the other thing is that you can rely on your specialist. And this is really what we tell people the most, is if you're not really comfortable with it, honest to goodness, go get a specialist you trust, and make sure that you trust that specialist, that there's someone who's going to take care of you, take care of your patient, not throw you under the bus, and not just care about making money, but care about what's happening with your patient. And when you got that, you've got a friend, and you got a friend. It's like that genie in Aladdin.
That's funny, Ryan. You Googled that. There were the hygienists doing the dentistry, and you pulled up and you sent it to me. And this was just last week too, but this one last week was in Idaho.
Oh, okay.
He's talking about one in. You said
there was one here in. It was in Arizona. Yeah,
it was in Arizona.
I can't remember if it
that
was
is hilarious.
Mesa or Glendale, but
and
yeah.
Ryan was able to find one a week ago in Idaho.
Yeah.
So back to the. I was lecturing at the Dental Insurance Association.
And by the way, you're an amazing lecturer. I've heard you speak. You're just awesome.
Well,
not that we're in a mutual admiration society here, but yeah, you're great.
Well, I'm trying to do my hair like you. I'm trying to be Rob Roda,
and I'm trying to be Dwayne Johnson.
But actually, you'll find my name in this book too. I don't know if you know that, but I opened up on a page and I just wrote my name in there. And Ryan says I was disgracing property, but anyway, I was lecturing down there, and there was about 300 insurance people there. Insurance people are weird. Like, they'll go to lunch with you, they'll go to dinner with you, they'll stay in the bar and drink till 3 in the morning, show you all their data.
Yeah.
And then I'll say, can I just have this chart and publish it in Dental Town? No.
Oh, yeah.
They're all their data is, it's like...
Were you at the Dental Consultants meeting up here at Talking Stick? That was about a month ago.
No, I did not do that one. God, I wish I would have gotten that. This one was in Florida.
Okay.
And but anyway, you talk about it's an art and a science. So after you network with 10 or 15 people, they were all showing me the same data, because I asked about Muller Endo a lot. They were saying, when you have 10 people look at a root canal and say that that was successful, you might say, well, it's short, this, that. The insurance people, they're brutal. They're just like, is the tooth still in the mouth? If it's in the mouth, it's work. Yeah. They're showing that at 5 years, which is just 60 months. If an endodontist does the molar, 5% of them are extracted at 60 months. If a general dentist does it, 10% are extracted at 60 months. So my question to you is, why do you think 1 out of 20 molar root canals are extracted in 5 years by an endodontist, and why do you think it's twice that rate for a general dentist? What do you think the endodontists are doing wrong to have 5% fail at 5 years, and what are the general dentists doing wrong to double that?
Well, first of all, I think that 5% failure rate over
5 years.
5 years is not bad. That's actually pretty good. In fact,
Most
even the 10%
marriages don't last that long.
Yeah, yeah, exactly.
I believe 1/3 of marriages in the United States fail before 5 years.
Before 5 years, oh my God.
Yeah.
So, but I think that...
Is that your new warranty? This will last as long as your marriage.
That's right. Oh my gosh. No, I think that well, one of the big things is simple. It sounds so stupid, but just simple rubber dam use. Endodontists always make a big deal out of rubber dams, and because they are a big deal. It's the only way to keep the bacteria from the mouth from getting into the tooth, from the saliva from getting in the tooth. You can use various things, even this, what's that thing called, with the barrier?
Isolite?
Isolite, yeah. The isolite manufacturers promote that as being useful for endodontics, but the trouble is that when people breathe, it aerosolizes the bacteria in their oropharynx, and some of them are going to land in the prep. And the only way to do that right now is with a rubber dam. And yet there was a study in 2013 in the Journal of the American Dental Association that showed that only 44% of general dentists use rubber dam all the time when they're doing root canal. And the other 56% did not, or used it sometimes but not always. Whereas with endodontists, it's 100%. Right there, you have a measurable reason why. And there have been subsequent studies that showed that if you didn't use a rubber dam, you will end up having a higher failure rate than if you did. It's not a huge amount, but the success rate drops by, 3 to 10%, something like that, which seems to be in the range of what we're talking about. The other issue is that I saw this guy in New Zealand speaking. He was a risk management guy from London, working for an insurance company in London that insured all the New Zealand dentists. And he was doing a risk management presentation. He had this great chart, and it was a pie chart. And it had right here was stuff you know. And then there was a little bigger one. It said stuff you know you don't know. And then all the rest of the whole pie chart was stuff that you don't even know you don't know. And therein is another big part of the problem is that when you and I were in school, dentistry was this big. Dentistry was the size of a basketball. The sum knowledge of all of dentistry was the size of a basketball. Now, that sum knowledge is about the size of a beach ball. And yet we still have 4 years for dental school. They haven't made it 5 years. They haven't insisted on a GPR like they did in New York, but most states don't do that. And so what happens is that people end up they have to cut back somewhere. And unfortunately, endodontic education has been cut back in a lot of places. We did a survey at the AAE in 2012, and some huge percentage of our undergraduate educators, people that are in dental schools that train the general dentists of the future, and I don't want to quote the exact numbers, but in my head I almost want to say 75% of them, I agreed with the statement that their graduates were incapable of doing endodontic therapy to a competent level, or they weren't sure whether they were capable of doing endodontics to a competent level. And that was incredibly disturbing for the board of directors at the AAE when we heard that survey result. It was unbelievable. It's the biggest indictment we saw, which was even our educators are saying that these kids aren't getting enough training in endodontics. And so, and it's not going to get better because they have to get training in implants. When you and I were in school, the implants weren't really taught, or cosmetic dentistry. They need all these things. So something has to give, and so they've cut back on endodontics. And this really means that not only does that 25-year-old who's trying to make a decision in Glendale as to what to do with this tooth, not only do they have to maybe read a book, but they are going to have to do some courses. They're going to have to engage. And personally, I'm a big promoter of study clubs. I think study clubs are awesome. And I've been training dentists up in Canada for 15 years.
Were you born in Canada?
No, I was born in France. My dad
Seriously?
my dad worked for TWA, so we were all over the place.
Paris, France?
Yeah, I was born in the American Hospital in Paris.
So you lived in 3 countries.
Actually,
Paris,
I went to high school in Frankfurt, Germany, so I've lived in 4.
Oh my God, that's probably why you're all so open-minded and well-rounded. And
Well, I don't know about open-minded or well-rounded. I think that it gives me perspectives that are beyond what we would normally get, if you lived in the same town your whole life. So.
I think people who have been, like today's the day we just found out Anthony Bourdain took his own life.
No way.
Yeah, he committed suicide last night.
No way.
But guys like that who, he was a chef, but he went and...
Kate Spade.
And all over the world, who's from Arizona? David Spade's from Arizona, and the Spade family's from Arizona. But they get such an interesting perspective, because if all you know is your little blue city, you need to see the red ones and the purple ones and the green ones. And And I thought Anthony Bourdain was so intellectual because he cooked in a restaurant in damn near every country.
The CDC just came out with a report in February that said that for the first time in the history of, first time since World War II, that the life expectancy in the United States has dropped. That happened in 2016. That was the first year ever since World War II that life expectancy in the United States dropped. And last year, 2017, it dropped again, and it's it's 2 years in a row. There hasn't been 2 years in a row in I don't know how long. Yeah. And they blame it on the suicide, which they just came out with a report yesterday in the MMWR from the CDC, said the rates of suicide have jumped up 30% all over the United States, and except in Nevada. So one where it was flat. No one's killing themselves in Nevada, so I guess the gambling must be good. And then the other was the opioid epidemic, and the CDC named it in this one in February. They said we are in the midst of an epidemic of despair, and hearing about Kate Spade and Anthony Bourdain now, I didn't know that. That's just awful. And so you look at the opioid epidemic and you say to yourself, all these people taking all these drugs, why are they doing it? And the CDC calls it despair. And that's what really bothers me the most when you said earlier that, they're blaming the dentist for doing this and doing that. It's not the dentist's fault. This is a symptom of a bigger problem in society, a much bigger problem in society that unfortunately can't be fixed by you and I, because if we could, I would fix it and I know you would too. So.
Staying on the subject of despair, let's go straight into dental insurance.
Okay.
So you lived in Paris, France?
Well, I was 3 when I left France, but I lived in Germany when I was in high school.
Okay, so I think 3 of the greatest cities I've ever lectured in is Tokyo, Paris, and London.
Yeah.
And all 3 of those, we're talking about root canals versus implantology, all 3 of those, Tokyo, Paris, London, the government pays $100 for a molar root canal.
Yeah.
So when we were podcasting dentists from Japan and Paris and London, they told you all of this at the bar while you're drinking beers, but as soon as the camera turned on, they all clammed up. But this is what they all told me, and Ryan is my witness. They say, well, when someone comes in and gets a root canal, you Americans, what do you think the average general dentist gets for a molar root canal in Arizona, and what would the endodontist get in Arizona? Yeah. What would you guess?
Here?
Yeah, in Arizona.
Well, I think the average endodontist probably gets about $1,200 to $1,500, and I think the GP for a molar, and the GP probably gets about $900 to $1,100. Okay. Although I got GPs that charge more than I do, but I get.
Okay, so could you do your Rob Roda root canal for $100?
No.
Okay, so that's what they tell you. They go, look, we're in Japan.
Yeah.
It's very expensive. My rent. By the way, if you think your office is you need a bigger office, go to Japan, because when you go to civilizations where in Tokyo, land is $1 million a square meter. So you could go into a dental office size as this dining room. They'd squeeze 3 operatories in there and the receptions. In this room.
Yeah. And
so they say, we need to pull that tooth because the implant is not on the list.
Yeah.
So then they'll charge market wages like $1,500 for the implant, $1,000 for the crown. So when you live in Tokyo, where land's $1 million a square meter, Paris, France isn't any cheaper. London, crazy overhead.
Oh yeah.
And the government, the NHS, say, no, you only get $100 and you have to take this fee and you have to be a provider. So we're seeing around the world molar endo plummeting and implants taking off simply because the third provider, and that's what I never understood with insurance, I mean, I understand if it's a benefit and they say, hey, your government wants to help you get a molar root canal. So here's $100, go where you want, knock yourself out.
Right.
That's a subsidy helping you.
Yeah.
But it's not a subsidy helping, it's controlling you.
Right.
When they say, oh, we'll give you $100, but that dentist can't charge more than $100. Right. I see the same thing with so many things, like government housing. You go back to Johnson's big
Great Society.
Great Society. He didn't say, hey, Rob, here's $100. When you go out to find a home, we're going to give you $100 a month. Maybe you want to buy a trailer. Maybe you want a condo. Maybe you want to live with your mom and pay your mom $100. No. We don't do that. You have to live in our government housing.
You got to live in a project.
You have to live in the projects. Well, can I have some money for groceries? No, you have to have stamps. And it's always about control. Yeah. So what would you say to dentists listening to you in Tokyo, Paris, and London who are extracting perfectly treatable teeth because they are participants of the NHS?
Yeah. You know, I first heard about this problem when I was at an implant course at the University of Frankfurt back in 2008, and the professor was teaching a group of endodontists from the United States, and we were all very unfamiliar with how that system worked over there. And he made the comment that apical surgery doesn't work, and there were a couple of professors from North Carolina in particular that were going over the chairs. They were going to throttle this guy, and it was hilarious. And he was like, well, no. He says, it doesn't work here because we only get paid $100 to do an apical surgery, and so we can't afford to use microscopes and ultrasonics and MTA and all these different things that make it work here. And so in a way, he was right. And when you have a situation like that, I don't know what I would say to the members of the dental profession in these countries other than try to change the law, try to change the rules, because you're absolutely right. It's a control thing as opposed to a helpful thing. And you know, in Canada, I did live there for 18 years. They have government programs. I was a general dentist, and they had a government program that paid for dental care for kids. They had a fee guide or a fee schedule, and you had to accept their fees, and you were not allowed to withdraw from the program. So it wasn't like Medicaid here, where if you didn't sign up, you didn't take Medicaid. Everybody had to take this plan. So if you had a kid come in under the age of 16, you knew that you were getting $20 for that filling instead of the normal $65 that you'd bill out. And that was in the 1980s. Don't go by those prices now. And you just had to do it. But you know, well, you know, everybody's Canadian. It's like, oh, sorry. And you know, you just say, okay, and you just did it because it was good for society. There were a lot of people that grumbled and complained, but you just kind of did it. Whereas it really is a form of control where people are trying to control the world. Whereas if you just gave them, like you said, some kind of a subsidy. And I think the fear is, oh, well, you know, if I give that guy $100, he's not going to give it to his mother for rent. He's going to go and buy drugs. And okay, figure out a way to prevent that from happening. But the thought that you somehow have to impose this much lower fee is, in my mind, kind of ridiculous. Although there's a lot of people that feel that, you know, dentistry should be given away free. And I challenge them to then pay the taxes to pay for that, because that's something that's not going to happen.
Yeah, like every time, who was that, Bernie Sanders say free healthcare? I mean, what does that mean? Is he going to come arrest me and take me to my office and chain me to the chair and I work free the rest of life? And then it's like, oh, no. We're just gonna take other people's money. Oh, so their money's free to you? Yeah. Everything's free in Wally World? And when you do it in any other industry, like when New York imposed a decade of rent control, you can only charge this much rent. Guess what happened? Nobody built one new unit of a rental property. So what did that do on supply and demand? Made rental properties more. I mean, it's it's so tough. Yeah. But you said something very interesting. You keep stepping into all these minefields. Is that a lot of you millennials come out of school and you say, well, I got $250,000 student loans. I'm not joining the Arizona Dental Association. Yeah. Dude, the insurance companies are lobbying your government every day. And Rob's best friend is, besides the ADA, is the Pew organization, which they name it Pew because it's Pew. And so it's phonetically correct. But you have all these interests. So you committed 8, 9, 10 years of college to be a doctor of dental surgery or a specialist. You've got $200,000-$300,000 of student loans. You don't think the insurance company, look at the rules. The insurance companies in Arizona, they can all compare their prices.
Yes, they can.
But if I got all the dentists in Ahwatukee to come to my house and compare prices, what would happen to me?
That's a criminal event.
Yeah. And so when you only got the American Dental Association is like your mom and dad. I don't care if you like them or don't like them. They're the only ones you got. My mom is officially batshit crazy. I'm the only normal one in our whole family. My 2 older sisters are nuns. How could they be normal, huh? In fact, when you started this deal, you said that the dentists are the high priest.
Yeah.
And my mom, ever since I was that tall, she just convinced me I had to be a priest. In fact, she'd always tell me, she said, Howie, you're so smart. You could be the first American pope. So when people say, why do you want to be a dentist? It's like, well, the alternative was a priest. And dentistry looks really, really good when you're not a priest. And but the bottom line is, what percent, they don't know what you do.
Okay.
What percent, what's going on state by state? I mean, what are you guys spending your time? They think you're just going out for dinner and having cigars and martinis. Right. But tell them that if the American Dental Association and all the state dental associations went away, we'd get ran over by the lobbyists for insurance, DSOs, like the dentists. My answer to the dentists in Japan and Tokyo, and that is, you got to draw the line in the sand. You can help and subsidize and say $100 for a molar root canal, but you can't draw the line and say that has to be the fee. And then the state could even put out a list and say, okay, here's all the dentists in Tokyo. Here's the ones that will accept $100 payment in full, and here's the ones that will just accept it as a subsidy. I mean, but when the government starts drawing a line, the dentists have to get politically organized.
Yes.
And you need to go back to the government of Japan and France and England, and we need to do it in Arizona, because again, that's where the abuse is. It's okay to say, Howard, I will only pay a $100 benefit towards an MOD posterior composite. That's great. But when you say I have to do it for that, well, I either got to stop doing it or switch to amalgam, or so talk about what the political branch of the American, because I've been a due-paying member for 30 years, because someone has to speak politically for our profession.
Well, the problem is that dentistry is a cottage industry. We are a group of small manufacturers, small businesses, and what the Dental Association does is it unifies everybody together and gives us a political voice. Now, what that entails is activity at the federal level. But at the federal level, to be honest with you, the activity is it's important and it's effective, but it's not that often it's something that the federal level affects you. It's at the state level where it really affects you. And so, for example, here in Arizona, several years ago, we found out by just checking the budgets of the state dental board that the dental board had millions of dollars sitting in their reserve. And every organization, including our dental association and charities and all these, they have a reserve fund. It's your rainy day fund, what you take care of, takes care of you if income goes down. And so the board had one of these. They had millions of dollars in there. In fact, they had so much that they had enough, if they stopped charging for any kind of license fees at all, they had enough to run the board for 4 years. And we were like, wait, now that's ridiculous. You had all your money swept back in 2008 when the government stole all the money from the boards, which was an illegal tax on dentists, by the way. But now all of a sudden you've built it back up again, and it's because they're overcharging the dentists and the hygienists of this state. They're charging us for way more than it costs for them to run their enterprise there. And so the Dental Association went to the state legislature, and we ended up, after quite a bit of negotiation, having a law passed that has not only reduced the amount that we will be paying going forward, but for the next 3 triennial periods, in other words, until every dentist has relicensed, there's going to be no dental board fee for you. You have no licensure fee for the next triennial period. That'll save you $700 or $800 right there. And it's these kind of things that the Dental Association does. In the state of California, not necessarily a political thing, but Delta Dental of California was, and I don't remember the exact thing that they were doing something that was absolutely outrageous. And the CDA, the California Dental Association, sued them and just won $65 million, which is $5,500 per member of the CDA, and they're all getting a check. It's like, That's great. And not only that, but now Delta can't do this thing that they were doing. Now, we fortunately have a really good relationship with our Delta here in the state, but in California, the CDA and that Delta, they have a pretty adversarial relationship. Every state has their story of what they've done, and that's really where the rubber hits the road, is the state dental associations. And so I have people, they get angry, they say, that ADA, that's a terrible thing, it's a big monolithic green monster in Chicago, and da-da. You know what? The ADA definitely is the umbrella organization. They're the mothership. But it's the 50 state associations that you'll miss the most if you're not going to want to join, and if anything bad's going to happen to the ADA. It's the 50 state associations that you end up losing.
And by the time you're 65, how many thousands of hours have those dentists volunteered their time? How many?
Oh my gosh.
I mean, you're sitting there on the couch whining and not paying your check, and they're down there after their long day, and they got a wife and kids and family, and they got stuff to do, and they're going down. How many dental meetings have you gone to with no pay in your dental career?
Thousands.
I know, and I mean,
well,
it is vulgar. I mean, you either volunteer your time or you get out your damn checkbook and write the check. I mean, it's your profession. But I got one beef with Delta. And I've invited the guy, if you can deliver him to come here and talk, because I always...
Do you want him in the trunk of a car tied up?
No,
Because I can do that.
Hey, I grew up... Hey, look,
Joke.
I understand gentlemen disagree. How would you like to go to every family dinner with your mom where you got two sisters that are Catholic nuns and a gay brother? Isn't that nice? Isn't that nice?
Those are fun Thanksgivings.
And those are... So I understand that people can disagree. What I tell my sister nuns... Just leave him alone now, because you know when he dies he'll go to hell. Yeah. So just be nice to him now, because you know he's going to go to hell for eternity. So while he's here, just be real nice to him. But here's what I don't understand. So and I'm not a lawyer, I'm a dentist. But price discrimination. If I charge Bill Gates $1,000 for a can of Coke and you $1, Supreme Court said that's legal. You can't discriminate on price due to his wealth. Number two, price discrimination is legal. It's volume. If you buy one can of Coke, it's $1. But if Walmart or Fry's buys 100,000 cans of Coke, though they're going to get a discount, and the Supreme Court says the volume discount is legal, but you have to show your math because they want to be able to look into it and says, was there actually savings? But number three, they say is illegal, and that's geography, and that's what Delta, in my humble opinion, non-legal opinion, does. That is, like, take Arizona. So they'll sell dental insurance to a company like, say, Intel or Motorola or some state agency, and the people, and it's one fee per 1,000 or 100 or 10,000 or whatever. Well, those people are coming from South Phoenix, they're coming from Scottsdale, and if I go if I go to LA, if I go to Compton or Beverly Hills, or out here I go from South Phoenix to Scottsdale, and I buy a basket of goods. I go get a gallon of gas, a pack of Marlboro cigarettes, a gallon of milk, a loaf of bread, a basket of goods. They're the same price all in town. But in insurance, when that patient lives in Scottsdale and goes to the dentist, they'll pay a high fee, maybe $700, $800, $900 for a crown. But at Compton, or South Phoenix, they'll only get $600 for a crown. We just saw that in response to Pew wrote an article about something. You know, they're always saying this stuff that it doesn't make sense. And I've asked them to come on the show. Of course, that they won't. But this lady said, you know, it was a newspaper article about not enough dentists in rural Tennessee.
Right.
And she says, well, you know what? I couldn't make it anymore because of the UCR. So I moved 30 miles away to Memphis, and now my insurance UCR is twice. Wow. If they would have gave me twice the money, I'd still be out in rural. So then you even go to Arizona, you get a bypass in Scottsdale, they'll give you $100,000. Go get a bypass in Casa Grande, they'll give you $60,000. So but the Supreme Court says that is illegal. Pharmaceutical companies do it. They sell Viagra, $10 a pill in America, and they sell for 50 cents in India and Brazil and China. So internationally, they do it all day long, but our courts say that's not legal. But that's all I see in healthcare. And so every time I meet a registered nurse, an orthopedic surgeon, a lot of them say, well, I can't go rural because I can get twice the money for the same procedure if I move to Tucson or Phoenix. And I'm like, hell, in Phoenix, no, don't stop at Phoenix. Get your butt over to Scottsdale or Paradise Valley, because once they find out you're in Surprise, you're going to get a surprise when you open up in Surprise. So I just don't understand. I just think that's...
You know, this is another aspect.
I mean, maybe I'm the dumbest
industry.
guy in the block.
I was not aware that they had this huge geographic difference, and so I'm glad you told me that, because that's not something I'm going to look into.
And if I'm wrong, because I was wrong before, I always thought there was the Texas Dental Association that sued the implant guy, and you're telling me
it was the Dental Board.
The Dental Board.
Yeah.
So the government. So I missed that one. I was wrong. I'm sorry for spreading misinformation.
Well, I mean, I'll
who's
look into this and see what the deal is.
the guy? Who's the head of the Delta guy here?
The CEO. Oh shoot! I think the chairman of the board is Brian Harvey, who's a periodontist down in Tucson.
I want him on the show. I've been trying to get him as long as it's been getting you.
Okay.
See, stubbornness pays off. And the other thing, I have one other issue with Delta. The American Dental Association, I don't know how they did it, but they hired the greatest healthcare economist ever. He worked at the World Health Organization. He worked at the United Nations. What was it? Marko Vucic?
Marko Vucic.
Yeah, that's a name I'm just going to give up on. Marko, the guy is the smartest guy.
Yeah.
I mean, if the ADA fired him today, he'd get a job at the World Health Organization, CDC,
Anywhere.
Geneva, Switzerland. He'd go anywhere in the world.
Yeah, but they ain't firing him.
Yeah, and he likes Chicago.
Yeah.
And he's a Canadian.
Yeah, I'm not sure.
Yeah. I think he went to school in Canada.
Okay.
But he's been dying for years. Delta has all this insurance. Like we just talked about the insurance claim.
Yeah.
Like they show me at a bar, if they're drunk, that at 5 years, 5% of your root canals have failed.
Yeah.
Endodontists, whereas 10% of mine, general dentists. But he wants access. He wants to hit it with basic algorithms, and there's no transparency.
Yeah, it's really hard, and we've tried for many years, and every once in a while they open the books a little bit, and so you'll see a study. There was a big one done in Southern California at USC using an insurance database to look at the overall survival rate of teeth that have root canals. And some insurance company they had 1.5 million root canals they could look at and see what their success rate is. The insurance companies are sitting on the greatest gold mine of healthcare data that you can possibly imagine. And it's interesting that you mentioned Marko, because last year I went to one of the most fascinating lectures I ever went to. It was about big data, and big data is the new big thing. And there's a guy in Oklahoma at Oklahoma State University who is a wonderful guy named William Paiva. And this guy has his office of health informatics right between the medical school and the business college, and his building's in the middle. This guy has so much data on health, medical health data, because he had some company that just collects all this data. It's enterprise software, so it's like a Dentrix, except for medical practices and medical hospitals and all this kind of stuff. And this one company, and I'm sure there's others, but this one company has collected all this data, they anonymize it, and they give it to this guy. So this guy's there, and he comes and does presentation stuff, and mining that data produces so much astounding stuff. And so I told him, just for fun, because he was doing a presentation for endodontists, he said, where does endodontics and the medical field interact so I could maybe get some of this? I said, emergency rooms. I said, someone's going to go into an emergency room with a toothache or swollen face, and you can tell us how often that happened when these procedure codes. He says, oh, I know those codes. That's this, 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 and this. I said, yeah, pull those out. And that was 2 days before. He comes to the lecture, so it's 2 days later, and his staff has pulled together this thing that shows through time, because he's got 16 years worth of data, the amount of people in hospitals for toothaches and things kind of goes flat, and then all of a sudden 2008 hits, and all of the state governments immediately start cutting back on their Medicaid. Here in Arizona, we cut back on the adult Medicaid dental benefit, and all of a sudden, whoop, up hospitals like this, and then when they start putting it in, then it starts to level off and the economy gets better. And
what was his name?
William Paiva, P-A-I-V-A.
Can you find out William Paiva?
Such a smart man and wonderful guy.
What
really
city
nice
and state?
Oklahoma State.
Oklahoma
so wherever
State?
Oklahoma State University
Edmond?
is. Stillwell, Edmonds. It's
okay.
I don't know. It's somewhere in Oklahoma, but this guy's awesome. Anyway, so I put him together with Marko, and now they're doing it. But Google goes to William Paiva. Google goes to him to get medical data.
Yeah, because if you let our ADA amazing mind, Marco Vucic,
Yeah.
If you let, I mean, just basic algorithm, not to mention machine learning, artificial intelligence, because the reason I want is because my homies believe stuff they might as well believe in the tooth fairy. Like, you ask any dentist in Arizona after 2 beers, how long do you think the average posterior composite lasts? Mine lasts forever. Really? And how long do you think an amalgam? Because whenever you find what limited research they are, every time I find research, it'll be on like 27 teeth.
Yeah.
Or maybe a big study is like 150 molars, while Delta's sitting over there with 100 million claims.
Yeah.
And then, but what limited studies you do see, you see that like the average amalgam is lasting 15 years plus, the average posterior composite 6.5 years or less, and about 112% of all the dentists don't believe that.
Yeah.
But if they saw because they say, well, that's because the dentist across the street, he's horrible. I am all this.
Yeah.
Obviously, I walk on water. I mean, I could never swim as a child because I couldn't go under the water. I could only walk on the water. And my composites last 25 years. And Delta could come back and say, dude, not even 1% of the composites last 25 years.
Yeah.
So I think that, in MBA school, I got my MBA from ASU, they always talked about the balanced scorecard, and they said, it's so important to see the score because you start believing stuff. Man, I've gone so over with you, and I still got 2 more questions. Are you okay on time?
Yeah.
Because I still got 2 big questions. So why do you want to quit being an endodontist and work for Pew? Why is that your favorite organization on earth?
I would almost want to do that because they really need to hear other voices, and I'm not sure whose voices they're listening to or why they're listening to those voices. But they've been pushing this dental therapy thing, and their thrust of why they want to do it changes from place to place. Here in Arizona, they had a real difficult political minefield to go because our legislature is mainly conservative Republicans, but with a significant amount of more liberal type Democrats. And what happens is that the idea of a dental therapist, a mid-level provider with minimal training who can go out into, quote, rural areas or poor places and decrease the cost of dentistry, which you and I know is ridiculous, but they're going to go out there, and that really appeals to people who have a feel that they need to help socially their people. I had actually a Democratic congresswoman in one of the meetings down there ask me, she says, I'm from Tucson and I've got a lot of friends of mine that just can't afford dentistry, and I think this is going to make dentistry cheaper. She says, but if you decide that you don't want this to happen, and she was really misinterpreting what we were trying to say. She says, what do you tell my friends? And the first thing I said to her as well, I said, the first thing you can do is fluoridate the water in Tucson. That'll help them a lot more than these dental therapists will. And so, because you and I both know that, and that's what I loved about that podcast with Jeanette Budd that you did, Jeanette McLean, because preventing dental disease is a complicated, multifaceted effort that has to be undertaken diligently over long periods of time, and unfortunately with more funding than the politicians want to pay for. But if we did that, we would have a much better world. And so they throw this dental therapist thing, thinking that it's gonna correct it. Well, that appeals to a lot of the people on the, I don't want to use stereotypes. Okay, the left side of the political spectrum, they like that idea. On the right side of the political spectrum, all they want is what's going to make business get better. What's going to enhance decrease the cost of dentistry and make business more profitable. Yada yada yada. So Pew split their attack, and they supported a lot of the left-wing Democratic sort of public health types. And over here, they use the Goldwater Institute and a couple of other sort of real more conservative groups to push the idea that this is going to be the savior for the private practice of dentistry, and that somehow this would really enhance the income of private practice dentists. Well, you know what? If you and I and every other dentist in the state was busy and we couldn't see another patient because we were so busy and we're booked out 2 months ahead and we just don't have any openings in our day, and I'm sorry, I know you're in pain or your crown came off, I can't help you. You know what? Then therapists might help that. But why the heck would some 25-year-old kid in Glendale with 6-figure student loans sitting there with holes in their day, why would they want to employ a dental therapist? It's ludicrous. Sorry, I shouldn't use that word.
I did it twice.
Sorry,
At
Ludacris.
least throw Snoop Dogg under a bus.
Okay, so it's Snoop Dogg. It's crazy, right? but seriously, it's crazy, and that's not where. It's not a manpower problem, and Pew believes it's a manpower problem, and they have spent between them and the Kellogg Foundation, the AD estimates that they have spent $200 million in the last 10 years to push this dental therapy concept in all the states where they're pushing it. That is a massive amount of money. And
$200 million.
When I think of how much dentistry $200 million could have bought if you simply were giving it away to people, it's just astounding. And so with that kind of money, I have to believe that they do believe their message. But their message is so flawed that I want to go down there and talk to them, and I want to say, where do you get this message? Where does this come from? How does this jibe? Because both messages are flat. Your capitalist message on the Republican side is flat, is wrong. Your message on the Democratic side is wrong. New Zealand is where they've had therapists for the longest. They've had them there for about 95 years. And the dental therapists in New Zealand, despite their efforts at doing whatever, the work they do, the amount of kids that entered into hospitals for acute dental infections nearly tripled over the last 15 years. And so where's the dental therapist in preventing that? Therapy doesn't prevent anything. It's not a preventive it's not a group that's going to do dental prevention or preventing dental disease. Because dental disease prevention is not, by and large, a manpower issue. You know where it's a manpower issue? It's a manpower issue in Gabon. It's a manpower issue in Burkina Faso, where there's one dentist for every 14 million people. Yes, you got a manpower problem there. This is not a manpower problem here. And the way that a good friend of mine up in Flagstaff just characterized it perfectly. He said a few months ago, it's like trying to cure the smoking epidemic by creating more lung surgeons. That's not how you get people to stop smoking. You get people to stop smoking by preventive efforts. And this is where this whole concept falls down, and why Pew hasn't figured that out, that they're going to spend $200 million, maybe not them, part of it's from Kellogg, but these groups spend that kind of money on trying to push a concept that can't work versus using that kind of money to push preventive. You know what, $200 million bucks? You could put a toothbrush in the hands of every single human being on earth with that. And there's kids in our towns in South Phoenix that I know for a fact don't know what a toothbrush and floss is, because my first Give Kids a Smile Day down there 15 years ago, these kids came in from the Washington School District and their mouths were terrible. They were full of problems. And logistically, we were bad. It was our first time we ever did it. We were trying hard, we had meaning well, but we weren't efficient. And so I remember at the end of that day, having done 8 or 10 or 15 molar root canals, whatever I did, that there was a kid who had a swollen face who had to get back on the bus and go. And I said, no, I'll see him again. They said, no, he's back, he's gone. And I was like, oh my God, I cried all the way home. So the next year, we had our act together, and we really had it logistically. We were just a machine, and bam, 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 bam. And we got 3 times more dental work done at that event than we did 1 year before. All in the same place, all at the Boys and Girls Club on 16th and Buckeye or something like that, 16th Avenue and Buckeye. The third year, the same kids coming in from the school district didn't have as much dentistry to do. They didn't. The fillings that were there were still there, and the root canals that were there were good. They had some other things that weren't attacked last time, so they did that. These kids, their oral health was measurably better. And you know what? It wasn't because of the dentist doing fillings and crowns. It wasn't because of me doing root canals. It was because we had an army of hygienists that taught these kids how to brush and how to floss. And just by doing that, these kids took care of themselves. And $200 million bucks, buy an awful lot of toothbrushes.
And I just want to end on one note, because you've gone so into overtime, and I
apologize for that.
No. We're all great, but when he said $200 million, now remember this. So in the United States, there's 211,000 Americans alive with an active license to practice dentistry. But in reality, only 150,000 are general dentists that do 32 hours a week or more, and 30,000 are specialists like Rob, who's an endodontist, 32 hours a week or more. So that's 180,000. So if you took what Pew spent, $200 million, divide that by 180,000 general dentists and specialists working 32 hours a week or more in the United States of America, that's only $1,100 per person. That's what you're due. What are the dues for the ADA for a year?
$1,100.
Yeah, that's what I'm telling you. Because when you don't join, then they're going to run all over you, and you already invested all those student loans, all those years, and to come back and say, well, I'm not going to ever talk to my mom again because she doesn't, she eats meat and I'm a vegan. Oh, shut up. She's your mom, and they're all volunteers. Your mom's a volunteer. Once you're out of home, every time, when Grandpa Howie takes your phone call, I'm a volunteer. The ADA, it's all volunteers. But that $200 million, that's our dues. That's $1,100 a year per person. So pay your damn dues. And to shut up the anti-fluoridationists, they say, well, I don't want to fluoridate the water. I say, okay, fine, I'll compromise. Just fluoridate the Mountain Dew. Will you pass a law of that? Because, it's equally as stupid. You don't want to fluoridate the water? Then fluoridate the Mountain Dew. They come into my office. With their baby crying, with a 64-ounce Thirst Buster Mountain Dew, pipetting Mountain Dew into the mouth while feeding them Funyuns. And when they come back in my operatory, I said, you can't bring a Mountain Dew. I said, do you take your bong to church?
Oh my God.
You leave your bong at church, at home when you go to church, and you don't take Mountain Dew into the operatory. Because you got to talk real with these people. You got to keep it in their language, and they're just humans trying to get through life. Anyway, man, I could talk to you for 40 days and 40 nights. It's been such an honor for you to come on the show today. Thanks for coming over.
It's been great.
And
it's great.
And if you could deliver the Delta guy, I think they don't want to come because of Dentistry Uncensored. They think I'm going to attack. I'm not going to attack them. I just have questions.
Yeah.
And gentlemen can disagree, just like my sisters disagree with my brother. I get it.
Yeah.
And but I'd sure like to talk about it. So you're the godfather of Arizona, and I mean that sincerely. All my friends, you are. You're the godfather dentist of Arizona. I don't know who else would be that role. I don't know who the hell else would be that person. So if anybody that has a message to say, you know where I live, send them my way. Thanks for doing this at the end of a long week.
All right.
Ryan, thanks for working. And
thanks,
my
Ryan.
God, that was an awesome show.
I guess really the biggest benefit that I didn't expect. I expected that there would be certain financial benefits. The advocacy, of course, I expected that. The thing that I really didn't expect, I did not expect to be welcomed the way I was. I was a stranger here. I moved here from another state when I finished my residency program, and I didn't know anybody. And the first place I came to was the Dental Association, and I have made a network of wonderful people who I can ask questions of. I've been introduced to people in all specialties, all walks of life, the generalist, the hygienists, everybody that's a member of this wonderful, wonderful family that we call the Arizona Dental Association. That's what I really didn't expect, and it was absolutely marvelous, and I still to this day benefit from the contacts that I've made through this association.